The U.S. doesn't have a primary care backbone in that way. Health citizens in the U.S., if we are health citizens, do not have universal access to primary care. That helps lower healthcare costs and streamline, at least at the beginning, your pathway toward diagnosis and treatment. It's a smoother kind of streamlined approach. It ain't perfect everywhere, but we have that on-ramp, and then it gets you into the system.
You made me think about liberating power structures in that actually we may be on the cusp of a more sort of democratized, individualized access to high quality health information.
New choices, new players, new models of care. You know consumer-first healthcare is everywhere. For us to build the future, to see what's new, we gotta look at the world from a different point of view. Consumer innovation ain't going away. I say it's here to stay. Today it leads the way. We gotta drop the silos. We're all the same team. Experience, business, tech, and marketing. So join us now. Join the revolution. Consumer-first health is the evolution. Status quo or like status no. Yeah, this is the healthcare rap. Yo, come on, let's go. Welcome back to the leading podcast about consumer-centered healthcare. This is episode 379. I'm Jared Johnson, and here's what's going to go down today. We have the Flava of the week about my next recommendation of industry leaders to follow, watch, read, and listen to on the topic of consumer-centered care. Who's next on the list? I'll talk about that. Then we roll on with our annual predictions series, one of our most popular traditions, where we invite pairs of guests to make predictions about the healthcare landscape. Today we welcome back Jane Sarasohn-Kahn and Amy Heymans to share their predictions and why they think the environment is ripe for change. If you haven't had the chance to listen to the first in our series this year with Paul Schrimpf and Jeff Gorgie, I encourage you to do so. That's episode number 377. But right now, on to the awesomeness. Are you ready? Let's go! Flava of the week. Last week, I highlighted the microdosing podcast hosted by Paul Schrimpf, my first recommendation of people to follow, watch, read, and listen to in order to expand your perspective on consumer-centered care. My next recommendation is a familiar one for many of you. It's Health Populi, Jane Sarasohn-Kahn's blog, and what many consider the ultimate source of trend analysis on anything related to health consumerism, technology, economics, and policy. I've long been a fan of how Jane weaves these perspectives together on behalf of health citizens. The term she uses to refer to people's needs for access to healthcare, digital data rights and privacy, trust in institutions, and love for fellow health citizens. Recent posts include stats on healthy aging and health literacy, lessons on trauma-informed design from IKEA, and the Smart Home for Health brought to you by Samsung and Ashley Furniture. I love that she avoids industry jargon wherever possible, as well as how timely she addresses topics that are at times clearly on healthcare's radar screen, and at other times not as clearly until someone like Jane connects the dots for us. In a time when our industry has followed society's inability to hold civil discourse, I find it even more essential to seek out perspectives that are well-informed, well-intentioned, and well-respected. I had a high school history teacher who taught us about the concept of global thinking. It's a way of thinking that involves understanding the interconnectedness of the world and taking a big picture perspective. It means being curious about the world and other cultures and identifying how different systems are related. Global thinkers have multicultural awareness, employ systems thinking, and can adapt to new ideas and perspectives. Now, I didn't do as well in that history class as I had hoped, but I'll always remember how Mrs. McNeil encouraged us to think this way in 10th grade. Shout out to Cypress Falls High School in Houston, Texas. Anyway, the reason I bring that up is in healthcare, you don't get any better at global thinking than Jane Sarasohn-Kahn, which is why she's recognized around the world for her trend weaving. So there you go. I encourage you to check out the Health Populi blog at Health Populi. That's healthpopuli.com. And in a few moments, you'll understand exactly why, as she shares this year's predictions with Amy Heymans. Let's share more podcasts, blogs, videos, and other content that expand our knowledge of what consumer-centered care is really about. That's another way that we'll build the healthcare of tomorrow, and that's the Flava of the week. The flow. All right, everyone, let's get into the flow. Tell you what, this is another exciting episode here. Our annual prediction series continues, and I'm so pleased to have back a couple of our return guests who are just veterans at this predictions stuff. I've got Jane Sarasohn-Kahn. Jane, welcome back.
Happy to see you, Jared Johnson.
And we've got Amy Heymans returning also. Amy, good to see you again.
Hello. It's great to be here.
This is just like power-packed. I don't know how else to describe it. These are some of the episodes I go back and listen to. These are ones I refer back to and just think through because of the insights that have come. So rather than have much of a prolonged intro, I'd love to dive right in and just talk through what our format is today. Well, we've done for, I think this is year 4 of these predictions, and this is year 3 with the two of you. So loving this. What will be interesting will be to see how things have changed, right? It feels like more than a year. I think is the easiest way to say it since we last got on here together and we're going through these things. So the format will stay the same in that we just want to keep it open-ended. We just want to have some fun. We're not trying to be perfectly, look for anything in particular. We just want to be what we think and maybe hope a little bit might happen in some different areas of the consumer side of healthcare. So we just want to have some fun here. And these are just, again, predictions. I think we'll just start, as we have done in the past, with what you're seeing and where you'd like to see the industry go. Let's start with traditional providers. We can't have a conversation without, talking about traditional healthcare and where it's come from and what trends you expect to see. Jane, let's start with you on this one, and then Amy, if you want to hop in after that.
So first, thank you, Jared, for hosting and shepherding this. And Amy, I love being in the sandbox with you, as you know. So I'm really grateful that we can do this again for year 3. When we think back to when we first did this, then Jared mentioned this is our 3rd. So we were still thick in a long tail of the pandemic. And when we think about providers in the pandemic, the level of burnout that physicians, nurses, and pharmacists had as the front line of healthcare, that was already happening in terms of burnout and unwellness before the pandemic. The pandemic exacerbated that. And sad to say, here we are, late 24, entering 25, and there's still a significant alienation, exhaustion amongst our most precious human capital in healthcare, which is our frontline clinicians, doctors, nurses, pharmacists alike, in different ways, in different regions, some more than others. So we've seen in the physician community a rush toward practices getting sold, a lot of private equity involved to better or less outcomes for their practices, and nurses banding together, really trying to help each other hack through this era, and some good innovations in the nursing community where I have some involvement and love that. And then pharmacy, as we know, is challenged both in the retail environment and then in the hospital environment as well. So to your question, Jared, I think we've come through the long tail of the pandemic now, sort of a chronic thing with vaccinations not being taken up to the extent that they might. COVID-19, I'm talking about the upgrade, booster, whatever we want to call it. So I enter 2025 concerned about the clinicians in particular. Some hospitals have done really well coming out and people returning to care, but in some regions still there's what we call among consumers medical distancing. Some people still not returning to normal kinds of care. So we're seeing on the retail front, people still going to urgent care when they have to, but not every primary care clinician is doing that well, nor every hospital, and the margins are tight. And rural hospitals in particular are in such pain. So I think we're entering 25 with a very shattered rural healthcare system. And then FQHCs, our federally qualified health clinics, really concerned about funding as we enter a new presidential term in 2025.
Yeah, I agree, Jane, with the point you're making about burdenment of our caregivers and clinicians. I've specifically been looking at the future of primary care. As we know, there's a crisis in primary care. The numbers of primary care doctors is going down, and patients need primary care doctors in order to stay well, navigate the health system, manage their chronic condition. Primary care doctors are sort of their center point in terms of a human being of how they navigate all of this, just as there aren't enough and the ones that are there are increasingly burdened. And so when you look at that trend combined with AI, and hopefully how AI can help primary care doctors do more with less time, potentially more effectively, so that hopefully they can delegate some of the administrative minutia or the kind of things that they'd rather not be doing and focus on the human beings. And as we look at wayfinding and decision support, that perhaps patients will be able to leverage AI for that. But when I'm thinking about burdenment and I'm thinking about the revolution we went through or the evolution we went through with electronic medical records, understanding, of course, that they increased and enhanced access to data and therefore quality improved, but also it led to some of this burdenment. And, in a way that I don't know that we'll ever, or we haven't yet recovered from. And now as we're at the beginning of this next sort of revolution with AI, I'm thinking about how to design it so that it isn't something that happens to clinicians, that it happens to caregivers, that it happens to patients, but instead it's designed by them and for them so that they set the standards and the guidelines. And I believe that that's more commercializable than, more monetizable than just like looking at profit from the get-go. You have to have both. But my point is that hoping that, power to the people, as opposed to the innovation coming from industry first, if you will. I'm looking to see that kind of coordinated collaborative effort between corporations and the actual human beings who are going to be affected by this new wave of technology.
So what I'm hearing is that we really have an environment that's ripe for change. We talked last year about the effects of referring to it as something other than disruption and players in it as disruptors, where we're really talking about traditional versus non-traditional providers of care. But one way or the other, this environment has changed. It's just kind of matured, if you will, with some of the effects that we were looking at a year ago, 2 years ago, from what I hear. And this focus on being able to prioritize total human experience and everything that stems from that and flows from that is going to be important for us, is what I'm hearing. On the flip side of that, let's flip that to the non-traditional side of those who we'd include in this category of retail, health, consumer brands, basically anyone who hasn't been a traditional, an IDN, a health system, a hospital provider system of some kind. That there are still more than ever that are offering everything from primary care to membership-based structures to connected fitness plans, and the number of players out there continues to grow. And it does feel a little different though to me. So I'll just be curious what the two of you think. Amy, let's start with you on this one. What are you expecting to see or seeing right now when it comes to the non-traditional side?
Yeah, absolutely. It's a good question. So I'm taking the systems lens. I often think about how everything is interconnected. And I just discussed how patients have a hard time navigating the health system. It's confusing. It's frustrating. People don't know what to do first, where to go next. How is their actual health? What should they be focusing on? Who should they go to? It's really difficult to get a diagnosis. And then once you get a diagnosis, it's difficult to know what treatment to do or which one's going to work the best and sort of evaluate that. Similarly, it's hard to know sort of where you should be focusing, sleep, mood, activity, nutrition, all of these things. But I think people want health. They want vibrancy. They want to live their best lives, be their best selves. And when they look at this health system that we have, being as difficult and expensive as it is, people are obviously seeking alternative mechanisms, and companies who are looking at their brand promise, how are they going to manifest that? What is the experience? What are their customers thinking about it? How are they going to package it all together? How are they going to make it seamless and streamlined? And they're inventing things from scratch, standing on the shoulders of giants from, the newest evidence we have and the newest modern consumer models of interaction. They're going to companies that know how to do this, right? And so, that's the trend I'm seeing is companies that are saying, okay, this is a need that people have. Here's how we're going to cater to it. And we're going to make it really easy and cost effective. And I think it's going to continue to grow, and some convergence and integration is going to take place. But I'm really curious what Jane thinks about that.
So let me start and build on your observation about primary care. And because I have 2 passports, one to the US and one into the EU through Italy, I spend a fair amount of time in the EU talking healthcare, getting healthcare there too. And what's interesting is these countries in the EU, and really in the larger, richer countries in the OECD, the Organization of Economic Cooperation and Development, the wealthiest countries on the planet, from Japan to Australia to Canada, US, of course, UK, and the EU. These other countries outside of the US have a much stronger primary care backbone. In most of these countries, every health citizen, and I use that phrase a lot, has an on-ramp to primary care based on their postal code, where they live, who they work for, because some of these countries have mixed private-public programs. They're not all single-payer like the UK. And so the U.S. doesn't have a primary care backbone in that way. Health citizens in the U.S., if we are health citizens, do not have universal access to primary care. That helps lower healthcare costs and streamline, at least at the beginning, your pathway toward diagnosis and treatment. It's a smoother kind of streamlined approach. It ain't perfect everywhere, but we have that on-ramp, and then it gets you into the system. In the U.S., we've lacked systemness, to your point, Amy. And so I see in the immediate term now, people bringing primary care home in these ways you're mentioning, through wearable tech, through contracting health coaching, like through our friend Eugene Barukovich's growing company with Marina, his wife. These are things people take on themselves when they get frustrated, and they disrupt the system on their own by contracting with their own hard-won dollars, or through health plans sometimes, if they have a generous plan across a platform that allows people to pick and choose things. But through wearable tech, the growth of the rings. I'm showing my Oura ring right now. I have a first generation old Oura. It's a great, faithful sleep support friend to me. My Apple Watch, lots of things in the space I'm in right now, sensors and such. So those people who can afford and want to quantify themselves in these ways, it's a new generation of quantified self. It's a way I think about private equity in the market. This is like private health consumerism in the short run, to hack our way to some kind of care in a system that we like, that we curate ourselves. This is not for everybody, though. This is not health equity. This is, this promotes fragmentation in many ways. So it isn't a great way to go, but it is a way some people are living. And what I'm going to see at the upcoming Consumer Electronics Show, CES in Vegas, is more and more digital technologies that are individually really brilliant. And if they're smart developers, they are becoming part of the data ecosystem with each other using, sorry to be wonky, APIs and the ability to make the data liquid and bring it together, as some of the technologies I use now do with my EHR. Even Epic is starting to appify the EHR. So we're getting there, but we aren't there yet. And so it's going to be a very kludgy, fragmented time where, as is typical for the U.S., people with resources and literacy and access to rich health plans in a workplace will have access to this stuff. Interestingly, some Medicaid plans are now working with the likes of Aura and Instacart and other newfangled tech-enabled companies that help address social determinants of health. So I think there are a few Medicaid plans that are doing interesting things and Medicare Advantage plans. But again, these are one-off situations, and it's not homogeneous. It's not universal. So we've got a lot of gaps. Your original question, Jared, was on the retail health front. So we've seen Walgreens and CVS have missteps in their marketplaces. They're making changes, moving things around, divesting, reinvesting, doubling down in certain areas. But the solution in the next year or two is not going to be through those publicly traded entities that are accountable to shareholders and private equity investors in the immediate term. So we're going to see more developments, more innovations that are fragmented that we hope will come together, and a few systems doing really interesting work, health systems now, doing interesting work on virtual care, telehealth, and bringing neighborhoods together for population health in their communities. So we see green shoots of that in certain marketplaces that are exciting to see. I was recently, for example, in, of all places, Peoria, Illinois, with OSF On Call, which is one of the most digitized wired systems. OSF is the Order of St. Francis. And you may not think Catholic health systems have nuns who are clued in. Are you kidding me? They are amazing. I met one of the sisters, for example, who's a 3D printing expert. So, I mean, don't make assumptions about things unless you're on the ground seeing the reality. So I see some exciting developments on a one-off basis all over the U.S. and in parts of Europe, but still fragmentation prevails.
You made me think about, Jane, the DIY health.
Yeah.
Hacking health. And you made me think about Susanna Fox's book, Rebel Health.
Right.
And you made me think about liberating power structures, and that actually we may be on the cusp of a more sort of democratized, individualized access to high quality health information. I mean, we know that people are looking to AI for health information, and they are using AI as a doctor, like it or not. It's happening. Now, the hope is it's going to be accurate information, but if everyone has access and it's just in time, and we sort of build these networked relationships through that, really interesting things can happen as people sort of, like I said, opt out of the madness and sort of adopt a more DIY, hacking my own path sort of approach, and hopefully learning from others. I mean, you look on YouTube, you can get physical therapy tips, for specific things. And, it's like there's so much information out there, as we know. Now, obviously, we also need the humans, but again, I'm hoping for the two to come together so that we have the best of human relationships and support and compassion, and in leveraging that skill set while also, providing better access to good information for everyone.
Yeah, I mean, TikTok's become a place, even a couple of the pharma companies that I interact with go to TikTok now to have information disseminated in viral kinds of ways. And who would have thought that would be the case even 3 years ago? So I think your point about information is really important. And now we think about the role of trust in all of this. And when you brought up AI, my mind's toggling to my continued observations that there's a concerned embrace of AI, both in the clinician community and the consumer community. So while people can see the value of it, they worry about algorithms, security and privacy, bioethics, And so there is this balance where if we see a value exchange, like anything, we're willing to trade off personal data and our time and engagement. So in your world, ethics by design and privacy by design, I think, become key to the design, the conception, the design, deployment, and implementation of something across the whole journey.
Absolutely. Providing for ethics, providing for dignity throughout the whole process. Absolutely.
Yeah, I look forward to a time when the conversation is focused more on this holistic primary care backbone, as you referred to, and not the individual players and winners and losers. And look at those retailers. Yeah, they're having to double down. Yeah, they have to scale back. Haha. Like when that overall threat level can just go down, and we really can like clear the field, clear our line of vision a little bit, and say, hey, if I'm in a health system, why aren't I looking to partner with whatever, anything from a startup to a retail chain to somewhere who has something that we don't need to build ourselves, but ultimately improves access or any of the things we're talking about? I look forward to that. And I do hope we see some more of that, to both of your points, in this coming year. You know, we have a long way to go to be able to evolve the conversation and not focus, so much on these lightning rod organizations, because they are big consumer brands, because they feel like a threat. Hey, healthcare's our thing. You guys don't know it. Healthcare's hard. Leave it to us. And there's reason for that. The medical expertise that the industry has been built on saves lives, saves millions of lives. So finding that right balance, I think, between all those things is kind of the quest, and hopefully we do see more direction to both of your
And this
points.
is why I love, Jared, to your point, this is why I love futures thinking, because there are various types of futures that could unfold. Preferred futures, undesirable futures, weird futures, right? We were just talking about primary care and AI. I mean, we might run into situations where patients sue hospitals because they're not using AI to the fullest, and it results in quality concerns. I mean, so an organization, as individuals think about their future and how they're going to chart the path, organizations also need to think about the various futures that could occur, how they'll react, and hopefully set about the work of envisioning a preferred future. What would be the best of what we could offer with everything that we have at our fingertips now, which I feel like we can actually solve some meaningful challenges in front of us, things that we weren't even able to solve, 10, 20 years ago. I think we're at the cusp.
That's a really valid point. Well, let's add one more, I guess, piece of that triangle, which is the digital health side. So all these startups who, when we were talking about like one area versus holistically, a lot of these are either point solutions or just services for a very specific aspect of healthcare, a use case, a diagnosis, a treatment area, an aspect of care, a certain model. And I would think, that there's still space for all of these. There are more new entrants here also than ever. The board continues to grow. Jane, I'll flip it back to you on this. What do you think we'll see on the digital health side?
Well, I think one thing we know, and there are things we don't know on the uncertainty side. But if a startup wants to be innovative, they've really got to hit many parts of the quintuple aim. Either pick 3 out of 5, let's say. Lower per patient costs, improve the whole experience, the healthcare experience, drive outcomes, population health outcomes. And then the fourth leg of the stool is to address clinician burnout. So to Amy's point earlier about EHR deployment, it created a huge burden, which is still a scar for many clinicians, particularly older ones. And then the fifth leg of that stool is health equity and address social determinants. So if you can address 3 of those 5 things in a startup, you are more likely to get the eyes of investors who've been burnt and lost lots of money and not being able to exit from investments. So those would be my basic advice to folks saying, we have the next shiny new thing. Well, yeah, but it has to really impact cost, quality, experience, usability, and tequity. Health equity plus technology because we have too many things that don't do much of any of those things. So I think that's where I would start my assessment on my response to your question.
Yeah, I agree. And I'd add many digital health applications are point solutions by design. But when you think about all of the systems in our body and all the corporations we interact with and all of the things that happen to us on a daily basis, you can become quickly overwhelmed by all of those point solutions, right? And so how do these things meaningfully intersect, interact, aggregate up to give folks a holistic, prioritized picture of what's going on and where they should focus, right? I think that's both a gap and an opportunity. People will still rely upon point solutions in digital health, but I think collaboration and integration is key. Also, folks use apps, they use the internet, but also increasingly things are more relational, they're more conversational. So the best path to engagement may not be an app. It may be a texting, it may be a conversational text mechanism, especially as, people are having romantic relationships with AI. They're going to be having relationships with health bots, potentially via text message. And so it has to be designed correctly. You've heard me mention AI a lot. I think there's great possibility and great power in it, but we can't just, it's not the silver bullet. We can't just, throw AI at it and hope we're solving a problem. We still need to design the experience, design the system, refine it, make sure that we're getting the engagement, we're getting the outcomes. So I feel like we're, back in the cowboy days of the sort of, the dot-com boom when we were designing the internet, and now we're there again, and we just have to do so carefully. And I love Jane's point about the quintuple aim. It's such an important foundational thing to focus on.
Well, let's have a little bit of fun here. I think we did this last year too, but I'd love to hear, do we want to predict which big tech or big retail, we'll just throw that out to any non-traditional brand. Like who do you think is the big brand that we'll be talking about as a player the most in 2025?
Oof, I'm going to go to disruptors. I think we're going to see up and comers come up fast, especially because of social media. We see things just come out of nowhere and take hold very rapidly. So I would put my bet on the disruptors. I was thinking about, okay, what large corporations are making investments and sort of heading in the right direction. Nothing sort of came to mind there, though I think there is diligence around things that matter, and some strides will be made, and perhaps we'll be surprised by what comes out. But my money's on the disruptors.
So I'm going to pick one from disruptor, non-traditional, and one from traditional. So I think Amazon's playing a very long game in health and will continue to. I have friends in New York State who are dealing with a very end stage, tough cancer and have to order a lot of very esoteric supplies at home. So it's hospital at home. And Amazon's got stuff. They have durable medical equipment. They've got very strange little batteries for a feeding tube that's needed. And my friends are benefiting from that. So Amazon had worked with Zelf for a while, where a nurse or a doctor could order things and then get them delivered. And now you can do it yourself on Amazon. But also remember, Amazon has licenses for pharmacies in all 50 states through its acquisition of PillPack many years ago. And Amazon's playing the long game in pharmacy now. So where our retail pharmacies, i.e. Walgreens and CVS and Rite Aid, are in pain, and Amazon is there. Mark Cuban is there. So between the two of them, the wild card then for 25, 26 politically, and we're not going to talk a lot about that because it's so uncertain at this taping moment, is what will happen with PBM regulation and reform. Those are the pharmacy benefit managers. And, that's a wild card. We really today, the date today is December 3rd, just so you all know when we're talking. We don't know what we don't know about PBMs right now, but we know it's a thing. and we will be watching for any sort of reform on that. On the other side, I mentioned OSF healthcare. Some of our big health systems are very wired, very smart, have healthcare informaticists, nurse leaderships, diversity, and ethics by design. And we look at Mayo Clinic and what John Halamka is doing with the platform there. So don't count out our big, smart health systems who are collaborating. Amy's word collaboration is really important in their communities and across the ecosystem with the Instacarts of the world, nimble, small tech groups who really know AI for a particular condition and have good algorithms that are inclusive. So both sides, the provider communities that have these great investments in the informaticists and in digital infrastructure. And then I would look to Amazon and Mark Cuban on particularly the pharma and pharmacy side.
The one that I just feel like brand-wise has a stake that they could claim, which is Target. I always feel like just brand-wise that they have an experience that could lead to that trusted type of, there's never been any signal that they have any desire to get into primary care, right? That's probably smart. Like, man, I wonder what that would look like. So it's one I just like to prop up every year. Again, there's never been any indication. The biggest thing was a year, 12 to 18 months ago when they talked about like they were putting 1,000 new health and wellness products on the shelves. But yeah, like the way they stood up things in the stores with a focus on health and wellness. So there was a lot to be said there.
Yeah, I think the grocery store combined with grocery store pharmacies like Kroger Health is a very strong player. They're doing work in Medicare. So, and people love the grocery store as a health destination. So again, that's one of the things on my top 10 list to watch under the first 6 months of a Trump administration. I take your point on Target. Our personal pharmacy in the U.S. is a CVS pharmacy in a Target. And we get sort of the best of both worlds on our local. It's a mega Target. It's a huge Target footprint in our community. And it's a lovely pharmacy there where we also get our vaccines. So I like your point about that. But again, we're looking at shareholder companies where in this moment right now, Walmart's beating the pants off of Target for a variety of reasons. So I think the Target experience is great, but we're at again, in the retail environment, the scrutiny of big investors who are calling shots a lot these days in these companies.
Yeah, totally agreed. And I think whereas it used to be hey, let's make sure we get ourselves in the space. Let's have a multi-billion-dollar investment in here, because the other retailers are doing it. Now we're on the full opposite side of that.
Yeah, it's cost optimization. And it makes me wonder, there's opportunity to increase revenue through investment and innovation, especially now with, convergence and the technological advances that we were discussing, but I don't see much investment in that sort of innovation anymore, at least not as much as there used to be when we saw innovation in digital health, value-based care, all of these things. So I think there's tremendous opportunity if someone kind of put some dollars into R&D for these new things we're discussing.
Perfect. All right, so let's start to wrap here. Last question, which I always love to ask the two of you. This is more of the hopeful question than maybe the trying to read the tea leaves. But where do we want this to get us as a society, not just as an industry? Where do we hope that healthcare is and what it looks like 12 months from now?
12 months is really soon, particularly because we don't know about the new presidential executive branch administration and all the interesting healthcare cabinet names that we're facing from, RFK to Dr. Oz to Dr. Macri, etc. But if I were queen of American healthcare, I would, and I don't think it's doable in 12 months, but, it's doable, I'm hoping, in my lifetime anyway, and certainly my kids' lifetime. This idea of health citizenship, the way I look at it, is universal access, and I'm not saying single payer, I'm just saying everybody has access to primary care and health care. We have digital privacy like a GDPR or what we see in California or Washington State that covers not just what HIPAA covers, but all of our personal data, which is in retail and GPS data very relevant to our health and understanding our health 360 degrees 24/7. So we have healthcare access, privacy laws that make sense, a sense of public health and community health, public health, good information. And then the fourth leg of my quadruple aim for health citizenship is a social contract of love, LOVE, which is that we really do care about each other. I care about you. I care about Amy. I care about everybody listening when it comes to health, because your health impacts my health, and I'm selfish. So I want you to have good health, so I'll have good health too, mental, physical, social, and across all aspects. So yeah, that's my wish as healthcare queen.
I love it, Jane, and I love you too. And that was one of the things I was going to say. Also, I have two hopes. One is a hope that stems from a concern, and lots of folks are struggling financially. I mean, that's nothing new. We always have folks struggling financially, but I'm concerned that economic concerns, financial struggles will lead to avoidance of care. And so my hope is that people will have free access to information that helps them understand the economics of health better so that they can get the cheapest, fastest route to the best outcomes for them. So that would be my hope. And then spinning to the love and the community, folks are still suffering, in these post-COVID years from loneliness and isolation, from the kind of stress that comes, particularly in American society, though we're not unique, the stress that comes from the rat race, from working hard enough to make enough money to be able to afford the things that, supposedly we all should have. But I see the pendulum swinging in a new direction, putting priority on relationships over sort of the more commercial aspects. And relationships are the foundation for well-being, which is the foundation for health. And relationships, not only, our intimate relationships, friends, family, partners, but the relationships we have with community members. When we feel more supported, we're healthier. If I'm connected to somebody who has faced what I've gone through, what I'm going through now because they went through it, they're going to give me the best advice. I just facilitated a workshop with family members who have been affected by substance use and overdose, and the best support for families going through this situation is people who've been there before. And so where we lack the evidence basis to show that, peer support is more efficacious than other potential interventions, I think we're going to get there. So I think the love is going to be healing, it's going to be supportive, and it's going to get us to better health. So that's my hope.
Jane and Amy, you've delivered again. You've given us so much to think about. We have a whole year to sink our teeth into it and just look at what you've given us. What a gift you've truly given us. Thanks so much for joining us today.
Thank you.